All right, let's dive in. Today we're talking about something huge, the brand new 2025 CPR and Emergency Care Guidelines from the American Heart Association. And trust me, these aren't just a few small changes. This is basically a new blueprint for saving more lives, and we're going to walk through the most important updates, you and me, right now. So let's get right to the heart of it. Why is this so critical? Well, look at this number, 10%. That's it. That's the chance of survival if you have a cardiac arrest outside of a hospital. It's a really tough number to look at, right? And honestly, that single statistic is the reason for every single change we're about to talk about. The whole goal is to push that number up. Which, of course, leads to the big question. The only question that matters, really. How do we save more lives? How do we take that 10% and make it 15, 20, maybe even higher? Well, the answer isn't just one thing. It's about making every single step of the process stronger, from the very second someone collapses, all the way to the day they get to go home.
Okay, so to really get a handle on this, we first need to understand where this fight is actually taking place. And you might be surprised to learn that for cardiac arrest, the battlefield, it's usually your own living room.
Yeah, check this out. It kind of shatters a common myth, doesn't it? We always picture these things happening at a mall or on a sidewalk, but the reality? Over 80% of them happen at home. Just think about what that means. The first person there isn't going to be a paramedic. It's going to be a husband, a wife, a kid, a roommate. That's why what ordinary people do in those first few minutes is, well, it's everything. It's not just helpful, it's absolutely critical.
So if that's the where, what about the how? How do we make sure everything happens in the right order? Well, the American Heart Association has this fantastic framework for that. It's called the chain of survival. And it's exactly what it sounds like. A series of links that have to connect perfectly to give someone the best possible shot. And here it is, the whole 6-link chain for 2025. It all starts with the basics, spotting the emergency and calling for help. Then you've got high-quality CPR and getting a defibrillator on them. After that, the pros take over with advanced care. But here's what's really new and important. The chain doesn't stop there anymore. It now officially includes post-arrest care and long-term recovery. Because, you know the saying, a chain is only as strong as its weakest link. And these new guidelines have something to say about strengthening every single one of these. So let's start at the beginning with the first few links. The stuff that anyone can do. We're talking basic life support, or BLS. And the new guidelines have some really clear, simple updates that make a huge difference. Okay, so here are the big ones for any bystander. First things first, if you're by yourself, call 911 before you do anything else. Get help on the way. Then don't move the person. Just start CPR right there on the floor, wherever they are. Time is everything. Now for kids, it's a little different. Their problems are often about breathing, so giving breaths is super important. And when it comes to infants, oh boy, there are some big changes. This is probably one of the biggest changes you'll see. For forever, basically, we've taught people to use 2 fingers for infant CPR. Well, not anymore. The new guidelines say to stop doing that. And the reason is simple, really. The data just showed it wasn't working very well. It was really hard for people to get deep enough compressions to actually move blood around. So now the go-to methods are the 2-thumb technique, where you wrap your hands around the chest, or a 1-hand technique. They've also made things a lot clearer for choking. So the rhythm is the same for everyone, 5 back blows, then 5 thrusts. But what kind of thrusts is the key? For an infant, you use chest thrusts. I'm going to say that again, chest thrusts. You never do abdominal thrusts on a baby. You could cause some really serious damage. For older kids and adults, that's when you do the abdominal thrusts, what most of us know as the Heimlich. And the last big point for BLS is all about the AED, the defibrillator. The message here is simple. Speed. The second you have one, use it. Put the pads on, turn it on, follow the instructions. Don't wait, don't hesitate. For some of those chaotic heart rhythms, the ones an AED can actually fix, every single second you wait, the chances of survival just plummet. So get it on and use it fast. All right, so that's the basics. Now let's move up the chain to advanced life support. This is the stuff that paramedics, nurses, and doctors are doing. The next level of care. Okay, to get one of the biggest new rules for the pros, we have to talk about a specific, nasty heart rhythm. It's called polymorphic ventricular tachycardia. It's a mouthful, I know. But all you need to know is that it's complete chaos. When a medic sees this on the monitor, it means the heart isn't beating, it's just quivering. It's not pumping any blood. It is incredibly dangerous.
And because it's so dangerous, the AHA decided to be, well, about as blunt as you can possibly be. Look at this quote directly from the new guidelines. It basically says, "This rhythm is always unstable and you need to shock it immediately." There is no gray area here, no wait and see. They're saying if you see this, you shock it, period. Waiting makes things worse. It's probably the most forceful statement in the whole set of guidelines.
Next up is how we get life-saving drugs into the body during an arrest. The best way, the gold standard, is still an IV line, right into a vein. But let's be real. In the middle of a chaotic emergency, trying to find a vein can be really, really hard. So the guidelines double down on the alternative, intraosseous access, or an IO. That's where they put a line directly into the bone. It sounds intense, but it's fast, it works, and it's a totally solid backup if getting an IV is proving to be a problem. Now for kids, the advanced guidelines get even more specific, and it's all about protecting their brains. For those heart rhythms that can't be shocked, the new rule is to get epinephrine in as fast as humanly possible. Then, after you get the heart back, the focus shifts. You have to prevent them from getting a fever, and you have to keep their blood pressure up. Both of those things are now known to be absolutely huge for helping protect the brain and leading to better recoveries. Okay, so we've talked about individual skills, both basic and advanced, and those are all vital. But to really, truly make a dent in that 10% survival rate, you have to zoom out. We need to talk about the entire system, how all the pieces fit together. And here's a system-level change that might sound a little backward at first. For years, the mantra was scoop and run. Just grab the patient and race to the hospital. But now the guidelines are saying, hold on a second. In many cases, it's actually better to stay on the scene and try to get the heart restarted right there. Why? It's simple, really. Have you ever tried to do anything precise in the back of a moving ambulance? It's nearly impossible to do really good, high-quality CPR while you're bouncing down the road.
So what does a really good system actually look like? Well, it's these 4 things. It starts with the community, getting as many people trained as possible. Then it's having professional teams, where everyone knows their exact job, like a pit crew. Third, you have to track your data. You can't get better if you don't know how you're doing. And finally, and this is so important, you have to take care of the rescuers, giving them a chance to talk through a tough call, to learn from it, and to process it. And that brings us to the last link in the chain. And in many ways, it's the most profound one. For decades, the goal was just to get the heart beating again. That was victory. But the 2025 guidelines are telling us, loud and clear, that's not the end of the story. It's not even close. It's just the start of a whole new chapter, recovery.
Just read this quote, it sums up this huge change in perspective perfectly. Surviving a cardiac arrest isn't like getting over the flu. It's a massive, life-changing event. And for the first time, the guidelines are officially saying that our job isn't done when they leave the hospital. We have to have a plan for them, a system to help them deal with all the challenges, physical, mental, emotional, that come with creating a new life after. So there you have it. The science is updated, the playbook is written, but a set of guidelines on a shelf doesn't save anyone. It takes people. It takes communities training their citizens. It takes paramedics and nurses and doctors. It takes every single one of us who might be that first person on the scene. The question isn't what should we do anymore. We know what to do. The real question is, who's going to step up and be the next link in that chain?